7:31 right now, and President Donald Trump restored the cuts made to the World Trade Center health program, but the fight for funding, well, that continues.
Yeah, that's because in 3 years, money will start running out for critical medical services provided to 9/11 survivors and first responders. So here to tell us more about it is 9/11 advocate John Feal, and he is joined by first responders NYPD Sgt. Tom Wilson and cancer survivor and FDNY Lieutenant Michael O'Connell. So welcome to all of you. Thanks for being with us. So can you just clarify for us, John? So the money that was originally cut by DOJ to the World Trade Center Health Fund, totally different from the funding to these medical services. Can you kind of clarify the difference between the two?
Yeah, well thank you for having me. DOJ cut 20% of the staff at the CDC, which would have directly impacted the World Trade Center Health Program. It would have delayed enrollment process and certification for illnesses. Also research and grants. What we're asking for now is $3 billion for the World Trade Center Health Program to continue its mission in helping, treating, and taking care of those affected by 9/11, whether they're first responders or those who lived or worked or went to school in Lower Manhattan. In 2015, there were 76,000 people in the program. Yeah. Now there's 140,000 people in the program. Nobody took into consideration medical inflation. So the pay for that went from 2015 to 2025 wasn't honored. We have enough money to 2090. Yeah. We don't have enough money for the next 2 years. But that's proof that DOJ made a mistake because we can stretch it out to 2027. Yeah. But what happens after 2027 will be a snowball effect.
Okay.
People will get sicker, people will die because they will not be able to get into the program. If you're already in the program, you'll get the help, but it won't be as quick as what you're getting now. Doctors and nurses will leave, and those doctors have 20-something years of expertise in what we're looking for. We have a higher survival rate than the general population now against cancers. Cutting the program was one thing. Demanding this $3 billion is another thing. And we have faced obstacles and hurdles the last 2 decades, and we're a formidable opponent. Yeah. And I'm confident we're going to get this done. We're hoping to get this attached March 12th to the spending deadline that they created their own mess. Okay. But let's see what happens.
Yeah, I mean, and they've already, DOJ has already faced some about faces. They cut Ebola funding and then said, well, that was a mistake. So then they kind of went back in and did it, right? So you're talking about the ripple effect that may need to be looked at here. But for somebody like you, Sergeant Wilson, you were exposed to toxins at ground, Sergeant Wilson, you were exposed to toxins at ground zero. You're a cancer survivor. So for somebody like you, how would this affect you moving forward?
Just a quick backstory. The World Trade Center Health Program saved my life by when I was diagnosed. And 9/11 responders have very aggressive forms of cancer. Yeah. My cancer was so aggressive it went into the skeletal muscle. So I was referred to a doctor that saved my life, Dr. Eric Gendon at Mount Sinai. If they are cut, people are going to die. Yeah. My fellow first responders are going to die. And what it also does is it causes extreme anxiety, which exacerbates the problems. When I get extreme anxiety, I've been diagnosed with mental health issues, but also the cancer treatments, the long-term effects, aggravates anxiety, makes it worse. You know, with scar tissue from the multiple surgeries and the radiation, so it's going to cause people to die. So that's why we're here. And there's a wall in Wisconsin that John established with thousands of names of first responders who perished of 9/11 illnesses. And every year, Mike and I ring a bell after the name is read, and it just it gets longer and longer, and we just want to keep people off that wall. Yeah. And that's it.
And Lieutenant O'Connell, I mean, this really is a lifeline for a lot of first responders, and those who haven't even been diagnosed yet.
Right. Yeah, so currently we have, like John said, about 140,000 people in the health program, and that's responders and survivors. This would obviously affect them tremendously, but there's an estimate 400,000 people that were affected by those toxins that are either not in the health program or are sick and don't really know about the program. I urge all those people out there to either find us and we'll help you get into the program and we'll get you the help that's needed. I mean, we sent children back to their schools back to nursery schools. And that's why we got this thing passed till 2090. So everybody not only has the coverage, we can go all the way to the end of lives of children.
Yeah.
I mean, we have people being diagnosed, with breast cancers and uterine cancers that went children that were at Stuyvesant High School. We need to protect everybody, not just responders.
Right. And, John, you mentioned that you're a formidable opponent, right? And I guess people haven't learned yet that you're not going to give up, and that you're a pretty vocal guy when it comes to these things. So what have the conversations been, right? Because this is relatively new in terms of the Doge. Have you had any kind of meetings, talk with congressional members about it, and how is it looking?
We've talked to Congress and Senate members.
Are they on board?
Yeah, well, they will be.
Yeah.
This isn't about politics. This is about humanity. Remove the R and remove the D.
Yeah.
And be a human being. There are good people, amazing people, that are dying because they were lied to on September 16, 2001, that the air was safe to breathe, the water was safe to drink. Nobody ever apologized. What they did was create the World Trade Center Health Program. But we had to go fight for it. They put a carrot on a stick, and we had to chase it for 2 decades. We're going to get this done. We want to be left alone. And if we're not left alone, we're going to fight back.
Is there somebody leading the charge that's on your side that can get it passed?
Well, Senator Gillibrand, Congressman Andrew Garabino, Senator Schumer. There's many members of the New York delegation. But we want that D or R in California or Missouri or wherever to get on board. Do what is morally right, not your obligation, just your responsibility as an elected official to serve and protect your constituents. Because there's somebody in the World Trade Center Health Program from every congressional district in the United States -1.
Right, and that's where the misconception is, why should New York get all the money all the time?
This is a New York issue. Exactly. That's, listen, we're sick and dying, but we're not stupid. We know the facts, and the facts are people are dying.
This is about humanity,
Yes, exactly.
not money.
Well, we appreciate all the work that you're doing, and we wish you all the best of luck.
Keep us posted, okay? I know you're going to you have a trip planned to go to D.C.?
We always have trips planned.
All right,
Yes.
well, keep us posted, all right? We want to
Make
hear
this
about
happen.
it.
Yes, sir.
Keep us in the know, all right?